The following video features a SmartLipo triplex treatment of the abdomen. This information should be used as a guideline only and should not take the place of your professional knowledge and training. For additional clinical information, please refer to the Clinical Reference Guide. For complete information on operating the device, please refer to the Operator Manual. Ensure that consent documentation is reviewed and signed prior to the procedure. Sample forms are provided in the Clinical Reference Guide. Patient marking is a critical step in the pre-treatment process. Some physicians may elect to indicate areas of bulging fat using his or her own style of marking. With the patient standing up, mark the treatment area and divide into 5 by 5 centimeter squares using the provided treatment template. Number each square to assist in documentation of laser treatment settings and endpoints during the procedure. Photographs should be taken before treatment and throughout the course of recovery to monitor the patient's response to the procedure. To assemble the SmartLipo handpiece, you will need the following sterile accessories: a SmartLipo handpiece, a Thermoguide cannula, and a laser fiber. Hold the Thermoguide cannula firmly on the top portion of the white housing and insert the handpiece lure lock into the cannula and then make 1/4 turn to lock in place. Do not over-tighten the cannula. Screw the metal thumb lock loosely into the handpiece and insert the fiber tip through the handpiece at the thumb lock end. Pass the fiber through the handpiece until the fiber tip is 1 to 2 millimeters beyond the distal end of the cannula and you see the color of the fiber come through. Turn the thumb lock on the end of the handpiece to secure the fiber in place. Pull the fiber to verify it's securely in place. Place the sterile accelerometer cover over the non-sterile accelerometer, then pull the sleeve back to cover the cable. Insert the accelerometer into the slot on the handpiece. Pass the proximal end of the fiber and Thermoguide out of the sterile field. Insert the proximal end of the fiber into the fiber aperture of the laser box. Turn the connector to tighten into place. Insert the proximal end of the Thermoguide into the Thermoguide port with the arrows facing up. Insert the proximal end of the accelerometer into the port labeled SmartSense. For complete instructions on laser assembly, disassembly, and sterilization information, refer to the Operator Manual. Prepare the patient per standard of care. If necessary, a sedative may be given to the patient either orally or by IM injection. Next, plan where to place your incision sites and place a mark for each site. The number of incisions is determined by the size of the area to be treated. The incision sites should allow easy accessibility to each square of the treatment area. Inject a small amount of local anesthesia to the incision sites. Use a no-core needle, trocar, or blade to create a small incision at the incision site. Introduce the tumescent anesthesia through the incision site to numb the entire treatment area.
What I use routinely for local anesthetic tumescent solution is 1,000 cc's of lactated ringers. I use epinephrine 1 to 1,000, and that is 1 cc of epinephrine 1 to 1,000. I then add 1% lidocaine plain, and that is given according to how much surface area I'm going to be treating for the SmartLipo procedure.
Refer to the Clinical Reference Guide for guidance on the treatment parameters. Treatment parameters vary depending on the areas being treated and the combination of selected wavelengths. Set the treatment parameters and Thermoguide settings using the touchpad on the laser system. Press On to arm the laser and press the foot switch to deliver pulses to the treatment area. Prior to firing the laser, be sure that the patient and all personnel in the room are wearing appropriate protective eyewear. Determine which area will be treated first and insert the laser cannula through the incision site. Position the cannula to treat the deep area first and then move to treat superficially. For deep treatment, the cannula should be placed approximately 10 to 30 millimeters into the fatty tissue below the skin surface and near the junction of the fat layer and the fascia. This may not apply to all areas or to all patients based on the amount of fat that needs to be removed. Do not place the cannula beyond the depth of fat tissue. For superficial treatment, position the cannula approximately 5 to 8 millimeters below the skin surface and begin the treatment at the distal point from the incision. Assure that the laser energy is delivered throughout the entire quadrant. When treating superficially, the red aiming beam can be seen under the skin to indicate the center of the treatment spot. If you feel a significant increase in resistance in the cannula advancement and observe a sudden decrease in the aiming beam intensity visualized through the skin, the cannula may be too deep into the tissue. Reposition the cannula before delivering laser energy. Reciprocate the handpiece assembly and fiber back and forth in a fan-like motion. To optimize the energy delivery, work in short cannula movements within a block of 2 to 4 5x5 centimeter squares. To prevent heat buildup at the incision site, do not pull the cannula all the way back to the incision site with each stroke. Continue reciprocating the handpiece assembly until there is a sufficient disruption of the fatty tissue. The amount of energy required to reach an appropriate endpoint or to produce the optimal superficial temperature rise will vary based on the amount of tumescent anesthesia used. Other factors that will determine the amount of energy required include treatment location and skin thickness.
3,400 going to 37.
Continue to monitor the subdermal temperature at both the treatment area and the incision site. Once the subdermal temperature reaches 38 degrees centigrade to 40 degrees centigrade, treatment needs to stop in this area. If the thermoguide alarm sounds, move the cannula to an adjacent square within the defined treatment block. Work within the treatment area until all the squares in the grid are treated and the total number of joules has been delivered. Monitoring the total number of joules delivered to the treatment area is critical for a safer and more effective outcome. Palpate the treated area to identify uniformity of adipose tissue removal and symmetry of treatment. Introduce a suction cannula to remove liquefied fat with either a peristaltic pump or syringe suction. If additional fat is to be reduced, carefully reintroduce the fiber assembly into the incision and continue treating as required. After the fat is removed, withdraw the cannula from the treatment site. Palpate the treated area to ensure symmetrical removal of fat. The clinical endpoint is determined by palpation and by creation of the optimal contour and shape. Aspiration is to be used at the discretion of the physician. Clean the incision sites with an antiseptic solution per standard of care and close the incision sites if needed. Standard of care post-op instructions will be provided to the patient and a compression garment is generally worn for a period of time determined by the physician.